on to the third topic of our workshop. Let me introduce the moderator for our third lecture, Dr. Shaoyuan Zhuang. Dr. Zhuang holds a PhD degree from Institute of Public Health at National Yangming University, Taiwan. He received the National Health Research Institute's Young Scholar Research Award for the year 2022. Dr. Zhuang specializes in cardiovascular epidemiology, cardiovascular risk assessment, metabolic syndrome, and obesity research. His research interests focus on developing empirical evidence for precision health. Without further ado, let's welcome Dr. Shaoyuan Zhuang, investigator, Institute of Population Health Sciences, NHRI Taiwan, to the stage. Please give a big round of applause for Dr. Zhuang. 欢迎庄教授。
Good afternoon, and ladies and gentlemen. I'm happy to have this chance to introduce our speaker. This session speaker is Dr. Heejin Kimm. She has multiple expertise. She is a family and a geriatric physician, epidemiologist, health educator, and evaluator. She is a professor of the Department of Epidemiology and Health Promotion, and the director of the Institute for Health Promotion in Graduate School of Public Health, Yonsei University, Korea. And her academic interests include research in communicable and non-communicable chronic disease, and health promotion, includes behavior change. She published articles issue about tobacco, alcohol, physical activity, metabolic syndrome, dyslipidemia, cardiovascular risk factor, stroke, cancer, and infection control disease. And let's welcome to Dr. Kimm's talk.
Thank you for the kind introduction, Moderator Chung, and thank you for the valuable opportunity to talk about lung cancer screening in Korea at this Asia Pacific Health Promotion and NCD workshop. And I also thank you, Dr. Teo. I think in Asian countries, Singapore, Taiwan, Japan, our issues and problems are very similar. So I understand, and also thank you, Dr. Oyumi. You already introduced about Korean background, so I wanted to go directly to the lung cancer screening. Maybe as lung cancer screening is now implemented in Taiwan, Singapore, and Korea, and in many other countries, including Europe. I think it would be helpful to share our experiences. Although I'm not directly involved in lung cancer screening, I would like to introduce the case of my colleagues on tobacco control at the Korean Society for Research on Nicotine and Tobacco, KSRNT Society, as well as the lawsuit of Korea Health Insurance Corporation related to lung cancer and related epidemiological studies of our lab. The National Cancer Center of Korea has published an article introducing the National Cancer Control Plan. So the proportion of older adults aged 65 years and over in Korea has been increasing. It was 18.6% in 2023, nearly 10 million. Cancer has consistently maintained the top position among this since the statistics were first released in 1983. Therefore, Korean government introduced the National Cancer Control Plan, NCCP, to reduce the individual and social burdens caused by cancer and to promote national health. During the past 25 years, 3 phases of the NCCP has been completed. The fourth NCCP was initiated in March 2021 with the vision of a healthy country with no cancer, no concerns about cancer anywhere at any time, which aims to build and disseminate high-quality cancer data, reduce preventable cancer cases, and reduce gap in cancer control. The main strategies include these 4. And the fourth NCCP has many positive expectations similar to the last 3 plans. However, cross-domain support and participation have been required to achieve positive result in cancer control. In the details of current NCCP, these are contents related with lung cancer. Within the strategy 2, within the strategy 2, there is 2.2, conducting high-quality cancer screening. So improvement of cancer screening based on scientific evidence. Lung cancer subdivide the screening criteria 5 to 6, improve screening methods, etc. And in the strategy 3, improvement in cancer treatment and response, strengthening response to future risk, infectious disease, etc. And the third topic is strengthening cancer management by age group according to changes in population structure. So in the elderly, they need more customized treatment and care strategies needed. And lung cancer is highlighted as a common cancer in the elderly. In epidata, we can understand the former smoker group is very big because the prevalence of tobacco smoking was about 70% before in Korea. Though many of them quit so far, and they are the elderly group that is currently entering on aging society, and the number is expected to increase further in the future, and therefore the number of lung cancer patients is also expected to increase further. Actually, lung cancer is already the #1 cause of death, cause of cancer death, followed by liver, colon, and pancreas cancer, according to COSIS statistics. Lung cancer net survival of 5 years during 2010 to 2014 was 25%. The incidence is not #1. It's similar with other countries. The incidence of cancer, #1 is thyroid cancer actually in Korea, and it was a mystery why thyroid cancer is #1, but a Korean epidemiologist reported that very active screening is one of the reasons for the increase of thyroid cancer. But lung cancer is #2. It's very similar with the thyroid cancer, nearly #1 incidence in men. And in women, the breast cancer, colon cancer is there, so the #4 is lung cancer. So the number and death cases is very big. already and will be increased in the future, we guess. Next, let's review the Korean low dose CT, LDCT lung cancer screening. It began at July 2019 as a national cancer screening program among men and women aged 50 to 74 years. I think it's very similar with Singapore. For smokers with a smoking history of more than 30 pack years who are at high risk developing lung cancer every 2 years with low dose chest CT, LDCT. Lung cancer screening has been added to the existing national screening program, which includes stomach, liver, colon, breast, and cervical cancer screening, with lung cancer screening being added as an additional screening as a national lung cancer screening program, so I will call it NLCSP. The coverage and eligible criteria are different in each cancers, but the hospitals, clinics, and basic delivery system was not newly established, and institutions that met the conditions among the existing cancer screening participating institutions also participated the new lung program. But so this is the invitation of National Health Insurance Corporation. So it is for nearly everyone in Korea who are covered by National Health Insurance, and Korean National Health Insurance covers over 95%, and the rest 5% covered by Medicaid. So nearly all people invited, if they are over 40 or 50 or they are in high risk. And the legal basis of notice of government is the revised enforcement decree of the Cancer Control Act and cancer screening standards. Examination cost is approximately 10,000 won is 240 Taiwan dollar, and it is 10% of co-payment of NHI, and the total cost is 2,640 Taiwan dollar. But it is free for the bottom 50% of health insurance premiums and medical benefit recipients. And there are more than 300 lung cancer screening institutions, 230 designated in 2019. Usually they are general hospital level or higher, so because of it is LDCT, small institutions who cover the basic health checkup did not join. The big hospitals participated, and the introduction of LDCT followed the presentation of evidence-based guideline in the academic groups by Korean Multi-Society Collaborate Committee in 2015. And a pilot study was done in 2017 to 18. The screening was implemented after the successful completion of the Korean lung cancer screening project, K-LUCAS, which assessed the effectiveness and feasibility of launching a national screening program for lung cancer. The K-LUCAS reported a high rate of early detection, a lower rate of false positive, and a decreased rate of complication compared to previous clinical trials. The background of this academic discussion was research in the US, Italy, should provide.
Being recorded and summarized.
Okay.
Yeah, thank you. Yeah. Yeah, that's okay.
So this page or
Oh yeah, right. So there were already clear evidence from several countries. So I think that's the background of very fast acceptance of this screening for Korean society, because for me, I can't remember this fast acceptance of new screening or new system in our society. And another point is our budget of health promotion is based on the National Health Promotion Fund, which was created through tobacco tax. So it should provide service for smokers who paid for those tax. That kind of idea is very common in people. And when previous research presented evidence that it could provide real benefits through early detection of lung cancer in smokers like this, it was possible to quickly discuss introduction. And another point was the activity of Korean guideline discussion through multi-society collaborative committee. In this society, the lung cancer physicians, radiologists, quit smoking clinic doctors, and policy experts, many area professionals joined, and they discussed very fastly. Yeah. So short-term outcome following introduction have recently been reported as follows. The effect of the NLCSP on one-year mortality in participating individuals with the history of lung cancer was investigated through national health insurance data. The hypothesis was that one-year mortality would be lower in individuals who participated in this screening after its implementation. Data was the 2018-2020 National Health Insurance Service data, and the difference approach between the case and control group before and after the intervention period was performed. So, yes, the case group, control group age was similar, and the smoking history was same with the screening guideline. And pre-intervention, post-intervention, duration was like that. And the result, the introduction of, and the number of final study population, about 26,000. Yeah. As a result, the introduction of the NLCSP was related to an overall decrease in one-year mortality, minus 3.21 percentage point, and it was significant. And specifically, the reduction was significant for lung cancer-related mortality, minus 2.69. But it was not in the other mortality. And stronger associations in individuals of older age residing in non-metropolitan area and who visited healthcare institutions in non-metropolitan areas were we could see. So conclusion was that implementation of this screening and one-year mortality in eligible individuals with a history of lung cancer was effective. And when DID was divided into subgroups, there were significant differences in age groups and all medical institution locations, but there was significant difference in residential areas only for patients in non-metropolitan areas. It means the benefit was more clear in rural area. Maybe through facilitate their screening in the scarce resource environment in the rural area. Additionally, this study is the result of asking field experts about problems and directions for development after implementation of screening. Research purpose was to understand the current status and problems of smoking cessation counseling in LDCT screening through a survey of clinicians participating in national lung cancer screening and smoking cessation treatment experts. Lung cancer screening institutions were limited to organizations participating in the national program and equipped with personnel, facilities, and equipment that comply with the standard for the designation of cancer screening institution. So the number of institutions, number of institutions were 308 at 2022. Lung cancer screening performance in 2022 was of the total 338,578 candidates, 42.5% underwent lung cancer screening. 32.5% of LDCT screenings received post-result counseling. It means the government invite all the candidates, but just 42% got the LDCT screening. So it is the 42% is actually lower than health checkup participation rate. So if you provide all your candidates, not all people will come, we can guess. The idea of a study is that screening should not be limited to early detection, but should also be able to induce smoking cessation. To do so, we should make full use of opportunity to undergo screening as an opportunity to motivate themselves to quit smoking. A survey was performed at December 2023, and 35 participants, including counseling physicians, and smoking cessation specialists. Questions include current status of the counseling and participants' opinion on the improvement measures. The results says counseling was provided to all examinee in 71 survey participants. And it was short. And counseling at the same day without consulting was high. So the response regarding strategies to support smoking cessation counseling, nearly 60% reported reimbursement of medication directly from the hospital EMR, they say. It means now they use separate system because the screening system is using national health insurance system separated with the hospital EMR. So the responders wanted to some convenient way. And in the interview, they talked about reimbursement or incentives. So the author's suggestion for lung cancer screening were opt-in strategy rather opt-out strategy rather than opt-in, because the smoking cessation advice should be provided to all the screening participants. The author thought it was the real beauty of this program, so we should utilize this opportunity more actively. And these are additional discussions. There are many suggestions, but I think the most important is also AI. In German case, they use AI for every case, and we can expect more effective and efficient process for the lung cancer screening also with AI imaging data. This is National Tobacco Control Center NODAM members campaign for young people. We also have e-cigarette problem, all the same. And this is the activities of National Tobacco Control Center and CAPI. So I'm also very happy with talking about CAPI Korean think tank of health promotion. And this is a story about lawsuit of national health insurance with tobacco industry. And in our institute, we reported some impact of cigarette smoking on the incidence of lung and laryngeal cancer, analyzed by histological type using the health insurance data cohort. So, and I also did some flavored tobacco and e-cigarette studies so far, and this is a new kind of disposable e-cigarette and new kind of tobacco product is continuously in the market, so we need more active research and response, I think. So thank you for listening.
Okay, and due to the time limit, and we open one question for audience. Okay. Any question from? Okay, and okay, if you don't have any question, I have one question about that. We know that smoking prevalence in women is very low in Taiwan, and how about the smoking prevalence in women among women in Korea? And we also know that the non-cancer in without smoking women, and they have different cause, and do you what is your strategy for those women without smoking, and to detect potential non-cancer? Thank you.
Thank you for the comments. In Korea, women's smoking rate was low, but it's increasing, particularly in young adolescent and young adults. The smoking rate and the e-cigarette smoking, HTP smoking rate is slightly increasing. It was dropped in COVID-19, but it rebounded last year again. And for the LDCT screening, women also invited, but the participation rate looks low, they say. So for active invitation and prevention strategy will be needed for women in the future.
Okay, thank you. So,
Thank you, Professor. Thank you, Professor Kim and Professor Zhuang. Ladies and gentlemen, we're now reached the first half of our workshop today. I can see in all your eyes that you really need an energy bar right now. So we are going to take a health break, and I just heard there are some amazing refreshments outside for you to enjoy. And you may also bring the food and drinks into this room as well. So we'll have a 5-minute health break. So please, I would like to have everyone to return to this room at 4:15. So you have about 5 minutes to enjoy. So now go run for your refreshments, and you can bring the food and drinks inside this room. We'll see everyone later at 4:15. Thank you.